I'm discussing today diabetes self-care for Asian Americans during the COVID-19 pandemic as part of Asian American Diabetes Initiative effort at the Joslin Diabetes Center, an affiliate of Harvard Medical School. I'm Dr. George L. King, Professor of Medicine and Ophthalmology at Harvard Medical School, and the founder of AADI and the Joslin Asian Clinic. There are two main types of diabetes, type 1 and type 2. They are somewhat different between Asian Americans and the general population of US. Type 1 diabetes is only 5 to 10% of the total, and it's very low rates among Asians. It's common in children and is requiring insulin for treatment, and is due to autoimmune destruction of the islet, which is the organ that makes insulin. It is part of a genetic change, so it is a genetic disease. Type 2 diabetes is a major cause of diabetes in the population, and especially in Asian Americans. Occur mostly in adults, but are increasing in children, especially in Asian Americans. It does not require insulin, and it usually occurs with aging, family history, and other factors, especially obesity. But the definition of obesity with lower BMI for Asian Americans, which I will discuss later. The prevalence of diabetes in various ethnic groups in the pandemic are different. Asian Americans have high rate of diabetes and high undiagnosed rate, as shown in this figure, and the data that's in the red bracket. And the green bar graph shows that Asian Americans have high rate of undiagnosed diabetes. This is likely due to the fact that we do not look overweight to healthcare providers. Therefore, the worry for diabetes is not so high. Major factors contributing to the cause of type 2 diabetes are, as I said before, overweight, which being different in Asians, diet, sedentary lifestyle, stress environments, genetics, perinatal or during fetal development, and increasing of age. Asian American, however, develop diabetes at low body weight, as shown here. If you look at the bar graph to the left, that the blue represent Asian Americans. As you can see, at low BMI or body weight, we have very high rate of diabetes compared to the white, Black, and Hispanic populations. Now, I mentioned BMI several times, or body mass index. It's a measure of body fat in adults. And you derive BMI by dividing body weight by your height. Now, let me discuss COVID-19 infection, which can affect people with diabetes to cause more severe infection. Now, COVID-19 infection is a new virus that can be transmitted through air and contaminated surfaces. The symptoms are coughing, shortness of breath, difficulty of breathing, fever and chills, muscle or body aches, vomiting or diarrhea, and new loss of taste or smell. If you have any of these symptoms, you should let your care provider know and be tested. How do you protect yourself from COVID-19 and your families and others? Avoid close contact, clean your hand often, cover your mouth and nose with masks, and cover cough and sneezes, and clean and disinfect surfaces at home and your hands. COVID infection affects all race and ethnic groups. There are already 11 million confirmed cases and more than 250,000 deaths in this country as of November 11th, 2020. We're now in a high spike of both infection and hospitalization and death due to COVID-19 in November 2020. There are different risk factors for COVID-19 death, as shown here, derived from Medicare data. As you can see, that increasing age certainly will increase the risk. If you looked at age between 80 and 84, you have 83%, 1.83-fold higher risk than if you're age of 60. And if you look at a race, the Asian population have 1.71-fold higher risk than the white population. If you look to the right table, diabetes have 1.18-fold risk higher than if you don't have diabetes of death due to COVID-19. So for Asian American, we have to be very careful in order not to contract COVID-19. And this is supported by many other studies. There's a study from United Kingdom, again showing that people from South Asia and East Asia have higher rate of hospitalization, as shown here, somewhere between 1.51 or 2.29-fold higher than the white population. Survival and critical care also is impacted by being South Asian or East Asian. In panel A, you could see that survival due to being from South Asia or East Asian is almost half compared to the white population. Other ethnic minority also suffer from more death. This graph shows that aging is a major risk factor as well, as shown here, that if you're over the age of 60, is much higher than younger people. The risk factor for severe courses of COVID-19 are multiple. I highlighted here since they're related to people with diabetes, kidney diseases, heart condition, obesity, and type 2 diabetes. Now, the CDC suggested that obesity with BMI of 30 have increased in risk, but for Asian Americans, this is not correct. For Asian American BMI greater than 25, we have already increased risk for severe course. This is data from China. As you can see, that if you look at the cases in COVID-19, it dramatically increases with BMI between 23 and 24. There are multiple ways for testing. You could have antibody testing, which will tell you if you have past infection. The viral test to see if you have current infection is another way of testing. And this is the way to tell you if you have infection. Who should get tested? Well, if you have symptoms, have had close contact with someone confirmed with COVID-19, or asked to get tested by healthcare provider or health department. Now, we also know that if you have diabetes, well-managed diabetes can increase your survival if you have COVID-19 infection. And this is a very important data from China showing that in Asians, poorly controlled people with diabetes survive less, as shown in the left panel in red. And if you show on the right side, the mortality rate or the death rate is actually almost 4 times higher in people with poor control diabetes. Now, how do you protect yourself and others from COVID-19? As we mentioned earlier, again, avoid close contact, cleanse your hand often, cover your face and mouth with and nose with masks, cover cough and sneeze, clean, disinfect the area you have touched. And lastly, good diabetes management, as we just said. Now, how do you better manage your diabetes? Well, you need to take the medication, monitor your diabetes, healthy eating, stay active, sleep, adequate sleep, staying positive, and healthy weight. Well-managed diabetes means your glucose in the morning while before eating is less than 130, and when the 2 hours after eating is 180. Like to keep your A1C level or the average of your glucose level over the last 3 months to be less than 7.0% if you're less than 60 years old. For those who are 60 or 70 years old or over or older, you check with your healthcare provider. Usually we like to keep your A1C to be around 7.5. So for your diabetes medication and devices, there are multiple great medications for their treatments, for your treatments. Insulin sensitizers, glucose blockers, or those cause your glucose to be excreted through the kidney. And also you need to control your high blood pressure. Don't stop taking your medication, and make sure also you have access to your healthcare provider for questions and for adequate supplies of your prescription and medical devices. Now, one thing we know that if you could decrease inflammation, you could decrease severity of COVID-19 infection. And what's causing inflammation in diabetes are obesity, high blood pressure, metabolic abnormalities, liver disease, type 2 diabetes, cardiovascular diseases. So we need to reduce inflammation to reduce the disease risk. One major way to do that is diet or nutrition. To have anti-inflammatory, anti-oxidative foods, as shown, some of them have shown here, and more are shown here, especially for Asians. There are multiple great Asian vegetables such as gailan, bitter melon, eggplants, and many others. Fruits are wonderful, as shown here. Traditional Asian diet, cooked fresh and with fresh ingredients, also known to decrease inflammation and weight. Some of them are exhibited here. Physical exercise is critical in the prevention and treatment of diabetes and reduce inflammation. Regular exercise is essential for overall health, even weight loss. Walking is a great form of exercise. If you can walk 7,000 steps a day, that would be great. and you can monitor that on your smartphone. If you could reduce your body weight by 5 to 10 pounds and decrease your BMI to 23, that will greatly reduce your inflammation in your body. Sleep, high quality sleep of 7 to 8 hours a night also is known to reduce inflammation and stress. Reduce stress and manage your mental health is critical. This can also reduce your diabetes, lower inflammation, and risk for severe COVID-19. Activities such as meditation for even 10-15 minutes a day will be very helpful. Again, we mentioned adequate sleep is also very important. In summary, Asian Americans do develop diabetes, type 2 diabetes at lower body weight. Many undiagnosed diabetes cases among Asian Americans. Mitigating the risk factors for severe course of COVID-19 include type 2 diabetes and obesity is important. Well managed and glycemic control diabetes can increase survival rate of COVID-19. And more importantly, in the next couple of months, please take the vaccine to COVID-19 when they are available. For further resources, please check our website on AADI at Joslin.org and contact us with questions and for various appointments and regarding COVID-19 as well. This is a picture of the staff of the AADI and Asian Clinic at the Joslin Diabetes Center. Thank you for your attention. Please keep safe and well during this difficult time.